I gotta stay modern, Mr. Thorwald. Be more than happy to send it out to you guys.
Oh, I've got it. I almost used it this morning.
Okay, we are streaming live.
I noticed that a flood of water just came into my office. Sorry. Terrible puns today.
All right, good afternoon, everybody. Welcome to the Arizona State Board of Pharmacy meeting. The time is 1 p.m. on August the 12th. I will call the meeting to order. Dr. Gandhi, if you can do roll call in conflicts of interest to establish a quorum.
Thank you, Madam Chair. Ms. Walmsley,
Present and mine have been submitted.
Mr. Thorwald,
Here, no conflict.
Mr. Al-Nassif,
Here with no conflicts.
and Ms. Park.
Here and conflicts have been submitted.
Thank you. All accounted for, Madam Chair. Oh, you're muted.
I was just undoing it. Thank you, Dr. Gandhi. Appreciate it. I'm going to go ahead and turn it over to Tariq to take the first two items that I am recused for, items 4A and 4B. So Tariq, if you want to take it.
Yep, thank you very much. So we start with item 4A, case 25-0244. Complained about pharmacy incorrectly processed patient's prescriptions under his father's name. I don't know if you have any thoughts about this. So what happened in this case, there is an intern who processing the data entry selected the father name instead of the son. Pharmacist did not catch the error when they're doing the DUR. The patient's parent came to pick up the medication. They couldn't find it. And that's another opportunity to catch the error. But they found it under the father name. They give it to the parent. Then they called the pharmacy to correct the error. Any thoughts?
Yeah.
I mean, go ahead.
Given that everybody asks for their date of birth, that seems to be pretty blatant. I mean, how do you make a mistake when you're asking for a person's date of birth along with their name?
I agree. I mean, the way I look at it, I mean, they did the error. The last chance to catch the error by asking date of birth and the name, and the intern missed this opportunity. And even though they found the medication type under wrong date of birth, they just give it to parents. And I believe at that time the parent was like unhappy because of what's going on. They couldn't find the medications, but this is not an excuse at all.
Yeah, I agree. I think there were multiple places where it could have been caught, could have been prevented, and despite the patient being upset, maybe leading to some being flustered, I think is how it was described. There's still those procedures and those steps in place to prevent.
Correct. Me personally, usually I'm like with the intern, like they are learning, I would be like more understanding, but this is beyond like being an intern. So unless somebody has a motion or other comments. I have a motion here.
Go ahead.
President, this is Ram, the CEO who investigated the complaint. Can I talk?
Yeah, please.
So the intern is the same intern who was involved in data entry and also the prescription sale. As you mentioned, he got flustered and then, when the mom said that give out whatever is ready, he just gave them out. He admitted to the mistake and he said that he will follow the procedures going forward. And the pharmacist who was involved in the data verification, product verification, he was apologetic. And when I went to the store to investigate the complaint, he was remorseful. And he said that going forward, he will follow the rules and follow the company policy.
Thank you, Ram.
Yeah, no problem.
Seems like they should have some CE and error prevention.
Yeah.
That's
So-
what I was thinking.
So my motion is to dismiss the permit holder, and for pharmacist and intern, I will go with 3 hours non-disciplinary action, 3 hours of continuous education regarding patient safety and preventing errors or error prevention. For
I'll
both.
second.
Any opposed? Motion carries. The other item is 4B, case number 25-0186 is prescription was dispensed to the wrong patient. In this case, I'm just reading my notes. I believe the staff involved is a pharmacist on duty and a clerk who give the wrong medication to the wrong patient. Both of them were refills, so did not require pharmacist consultation. And so the way I see it, like clerk, I don't think we can do anything. I know, Dr. Gandhi, have we done anything about clerk previously?
No, it's difficult for us to take a position on clerks because they're not registered or licensed by us.
Okay. I mean, I understand the clerk or any technicians work under pharmacist supervision, but I wonder like how the pharmacist will catch this before ended up to wrong patient.
That's always been the dilemma that board staff has had. And I think the burden falls on either the permit holder or the pharmacist on duty at that time.
Mrs. Sparks, do you have any?
Yeah, it's a tough one because I mean, there's clearly policies and, procedures and steps in place to catch it. It wasn't followed. And with this being a refill, it's hard for the pharmacist to maybe know in that situation that both prescriptions weren't scanned. And certainly if that second one had been, it would have been caught. That's the way I'm understanding it. So
Clerk, yeah, the clerk did not follow the policy otherwise.
right. So yes, it does fall to, I guess, the pharmacist on duty.
To me, it falls more to the permit holder versus the pharmacist because the procedures weren't followed. The pharmacist was, I don't see where the pharmacist could have.
Yeah, that's a tough one. I
That's
mean,
the challenge, yeah.
that's a challenge.
The,
Mhm.
it seems like the permit holder, to me, would have had to set the procedures and policies, and then provided that if they're not followed, to provide the discipline for that, not following that procedure and policy. And therefore, I would think that
I mean, I'm good
some
with,
action against the
yeah,
holder.
can be like maybe advisory letter for both permit holder and pharmacist, advisory letter and dismiss. No, I mean, yeah, just letter of concern for both.
Letter of concern for the permit holder and
holder
the pharmacist.
And pharmacist listed.
I mean, that seems reasonable to me.
I don't think there's anything else we could do.
Yeah, and this is my motion.
Second,
Any opposed? Motion carries. And I believe, yep, it's yours now.
Yep, item 4C, complaint number 25-0174. A prescription was dispensed with an incorrect medication.
This one I am recused, I think. Yep.
Yes. Looks like this was a typing error on an electronic prescription. That was ultimately missed by the pharmacist.
For a long time, and my other concern, which is out of our board scope, is provider like give more refills for the wrong medications.
Yeah. I mean, I can see how this error is made. Obviously, this is a look-alike, sound-alike drug, when you look at the two things.
Yeah.
My thought here was 3 hours patient safety CE for the tech and the pharmacist and dismiss the permit holder.
I agree with that. That's your motion, or you?
I was just jumping off discussion,
Yeah.
but I'm willing to make that my motion.
Yeah, this is my notes, and this is my recommendation when I wrote to myself. I agree with that, so
Okay, I'll make that my motion. Do you want a second?
I second.
Frank, any other discussion on it?
Just
All those in-
just a comment, Madam Chair.
Yeah.
I know when electronic prescriptions go through and they pre-populate, it'd be nice that pharmacists don't take it for face value and do their due diligence like they would a paper prescription. I think that's one of the issues that may be occurring out there, that they're trusting the system and it's transmitting properly.
Yeah,
So just an educational comment, that's all.
good point. All those in favor?
aye.
Aye. Any
Aye.
opposed? Hearing none, motion carries. Item 4D, complaint number 25-0232. Complainant alleged that the pharmacist did not provide adequate counseling on a new prescription.
Me reading the documents, I believe the pharmacist did not recall what's happened, but of course she apologized if that happened. I don't
mean-
really see evidence to support either way, to be honest. That's my perspective.
I feel the same way about it, Tariq. When I read it, I mean, the counseling was performed and was documented. I think what was said is a little bit of he said, she said. So my thought was to dismiss on this one.
I agree completely.
I agree as well.
Somebody want to make a motion?
I move we dismiss this.
Do I have a second?
Second.
All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Item 4E, complaint number 25-0183. A complaint was received, a complaint was received alleging that the pharmacist shared DUR override credentials with the non-pharmacist personnel and other employees, and another employee was threatening coworkers and counted medications in an insanitary manner.
There's a lot of in this in this case. So the fact giving the password, or username, or credential to technician. So my question to our compliance officer, is it like she give a badge to scan, or did she give actual username?
I'd be happy to answer that. Steve Hybert?
Yeah.
She shared her user credentials. It was like an identification code, which the pharmacist would input at the register at the point of sale when there was a hard stop placed on a prescription to stop it from being sold.
And from my read of this, Steve, please correct me if I'm wrong. It doesn't sound like this technician was working independently with this pharmacist credentials. They were using it to document the counseling that the pharmacist was providing to the technician that was then translating to the pharmacist to the patient since they were Spanish speaking.
That's the way their responses were. We don't really know whether, since that credential was shared, whether they just used it to bypass that to counseling and allow the prescription to be sold.
Yeah.
There was no way to tell from any type of video that I was provided.
Yeah.
Video is not a panacea. It's very unclear, and they don't usually
Yeah.
shoot video of the areas that you might need. But we did have admissions from both the involved pharmacist and the technician, from the pharmacist in regards to sharing of the credentials, and from the technician for counting out medications in an insanitary manner. The technician and all the people we spoke to and received written responses from all denied the allegation of the threatening with the weapon activity.
So she admitted to happened once, not multiple times, and she said the technician was translating, and she should have not given username under any circumstances.
Yeah.
Right.
Yep.
So
My thought was maybe look at like a letter of concern to the pharmacist for record keeping, since was obviously not that pharmacist that was responsible for the recording of that information, and the record is not right. Perhaps the same thing for the technician for the other behavior.
now for the technician using hands, this is really stopped me and made me think about it, right? Like,
Yeah.
he admitted for like, he admitted it, right? So there's evidence that he admitted what he did using his hands. I agree with the letter of concern to pharmacists. For the technician, I would really go with at minimum like CE, continuous education, regarding like, I don't know, hand hygiene, or I don't know if there's anything with pharmacy letter or something can support this part of workflow.
That would
It is
probably be very difficult to find.
Yeah.
Patient safety,
Yeah.
I don't.
I mean, it's at the very least, I would consider it unprofessional conduct, right? And the fact that
Yep.
it's pretty common sense not to be handling medications
Yeah.
with your hands that somebody else is going to then put in their mouth and ingest. I mean,
So there's any suggestion for CE, what type it is for profession? There's anything about
I
profession?
mean, I don't know what he's going to learn from CE. To me, this is, like I said, a common sense type of thing. So either I was kind of leaning towards a letter of concern, but I'm open to other ideas.
A $10 million fine or a letter of concern? I'd go for the letter of concern.
I'll go $10 million
I
fine.
think a $10 million fine is above our statutory limit, just saying, but maybe Gene can correct me. All right, do you have thoughts on a motion, guys?
I mean, I really want the continuous education toward the technician. You know what I mean? Like,
Okay. And under what topic?
yeah, and I don't know if we can add, I mean, I can make a motion now. I don't know if we can leave it for the board staff to work with to approve, talk to the technician to approve the CE, what type of CE. Is it possible, Dr. Gambi, to leave it for you to?
I'm just doing a quick query here to see if there's anything related to credentials or record keeping.
I mean, for the pharmacist, I believe we're gonna do a letter of advisory or letter of concern. That's our recommendation. We're asking for the pharmacy technician for using hands to count medications.
Is there anything with regard to just keeping the facility clean, hygiene, that type of thing?
I think we're gonna have a hard time finding CE in that.
I know I'm probably saying it wrong, but I know that where other facilities have been messy or boxes around it, I mean, it's not hygienic. Haven't we done something that
I mean, is there anything on like proper dispensing practices, or was he using like he was using an automation, like a machine?
and something that would also cover that?
Even compounding, maybe. Look at it.
Yeah, I mean, you got error prevention and all that, but as far as record keeping and keeping a pharmacy clean and stuff, it's not anything that's popping out right away.
I think I still think letter of concern there.
Okay.
Is that a motion?
Sure. A letter of concern regarding record keeping to the pharmacist, and a letter of concern for unprofessional conduct regarding the handling of medications to the technician, and dismiss the permit holder.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Item 4F, complaint number 25-0225. Prescription was entered and dispensed with an incorrect strength. Looks like this was a data entry error, data entry and verification error by the pharmacist. It looks like the pharmacist performed both the data entry and the prescription accuracy check.
Yeah, I will go with our standard non-disciplinary 3 hours continuous education and dismiss the permit holder. And this is my motion unless anyone
I'll
has.
second. That was
Motion.
what I was thinking.
Motion and a second. Any discussion?
And what
All those
topic,
in-
please?
Error prevention.
Thank you.
All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Tariq, I'm gonna give you 4G and 4H.
All right. There it is. So we have item 4G 25-0138. A patient alleged pharmacy dispensed different drug than what was prescribed by his doctor on 4 separate prescription orders. So I will give you a few seconds if you have any comments, because I read the documents, I didn't see any evidence.
Yeah, that's what I have noted here. I don't see any evidence of loss or dispensing error.
I didn't see any evidence unless our compliance officer can give us updates, or if we're mistaken here, we missed the evidence because I didn't see it.
Yeah, Steve Hyber here. Yeah. This, you might notice that I didn't list any violations on this particular investigation. And because if we probably just did a quick dismissal, a director dismissal, it would probably boomerang back on us. So I wanted to get this case in front of a full board review today and have an opportunity to present you all the evidence. And as you could see, that there was physical evidence, or actually photographic evidence provided by the complainant. And in many cases, that proves to be very accurate, or at least, it allows the board to make, to sustain a violation. Unfortunately, there's counteracting evidence that, we didn't have this actually occur for several reasons. The The audit came in good. And, we have some evidence on a purchase history side of the balance that the pharmacy, never stocked that particular form of
saw.
acetaminophen.
Mhm.
A tough decision, but, we on the investigation side leave it for you guys to make that decision.
So I move to dismiss for both, for dismiss this complaint due to lack of evidence.
I second.
Any comments? All in favor?
Aye.
Aye.
Motion carries, and it is for item 4H 25-0203. Prescription was filled incorrectly and dispensed to the patient 4 times. Any comments or? Is an error happened there, is give the wrong strength for to patients. And I see it like a human error should not take place from the beginning, but our standard is 3 hours non-disciplinary continuous education for error prevention or patient safety, and dismissing the permit holder unless you have comments or ideas. It would be my motion.
No, that's kind of what I had noted. I mean, there's obviously an error here that looks like it originated from a transferred prescription, and that's what I have noted was reasonable to me is the standard 3 hours of CE for error prevention.
Thank you. So did you second this?
I can second that, or if that was a motion.
Oh, I thought you did second and then you said the okay, and then continue. So we have a motion and a second. All in favor?
Aye.
Aye.
Aye. Motion carry, and then we go back to Mrs. Wamsley.
All right, item 4I, complaint number 25-0248. Gilead Sciences was using speaker programs to pay kickbacks to doctors and induce them to prescribe Gilead drugs. The only thing I could think of that was similar to this is we had an issue with Insys Therapeutics a few years ago. And but that case went on for a very long period of time, and they ultimately went out of business, so they surrendered their license. So nothing really exactly the same. I was thinking perhaps conference to get a better understanding of what they were doing and why they think that they weren't inducing people to prescribe, especially based on the fact that they are already admitted to it through the settlement agreement. So I'm thinking conference here.
That's I had conference to hear a little bit more in front of the board. It was, and then also just, has there been anything like this in the past, basically? So
the situation we
noted.
had with that other manufacturer that went out of business is the only one I can think about in the time that I've been on the board. And ultimately they ended up giving up their permit.
I'd be in favor of conference.
I would be too.
I agree with conference.
Okay, who would like to make that motion?
This is my motion. I make a motion.
Second.
All those in favor?
Aye.
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 Any opposed? Hearing none, motion carries. Tariq, you're up on 4J.
All right. So, item 4L 25-0323. It's a restaurant may have failed to
No,
report.
we're on J.
4J, Tariq.
Oh, yeah, I'm way ahead of you guys, right? So 4J, let me make sure. Okay, here it is. 25-0301. It's patient was not canceled on a new prescription.
My concern with this one was the I guess the documentation piece, the technician offering, accepting decline of counsel, and then upon inspection, the compliance officer observing the same behavior. And so it's concerning that they're not following, obviously, procedure. And it seems to be, my concern is just seems to be a bit of a culture, perhaps, or a repeating pattern.
I see it this way, yes, I agree. And also what concerned me when technicians ask patients, like, do you have questions, right? Patient, is there new medication? No, I don't have questions, but I want to talk about my medications, right? So I agree with your concern, like we share the same concern.
Yeah, I'm just trying to think, like, does it fit into the standard CE or letter of concern is kind of where I'm on the fence about.
It's literally violating the law, the current
Yeah.
law, right? It is not one isolated incident, and the fact that they have a compliance officer there,
Yeah,
they didn't
that's
even, did not even alert them at all, right? Because to your points, maybe it's a culture there.
yeah, and so I don't know, what CE would necessarily, that's what I'm kind of on the fence about. I don't know if a conference we would learn any more or have them maybe hear from them.
It's not really, I mean, for me, I have nothing to hear from them. That's me personally.
Yeah.
They did what they did, right? And it is not isolated case. It's, as you said, maybe it's a culture there. I know they're not going to learn nothing from CE, and hopefully they will never learn on the hard way. But I believe given the CE would, in law, because this is law and patient safety, that will send a stronger message to them to change the behavior.
To me, I think the CE is important, but I think this, if you're going to send a message, you should give them a few more hours than what we would normally do. It takes a lot to break a culture if it is that.
So what I'm thinking, dismiss permit holder and 3-hour CE for individuals, 3 of them in
law.
Yeah. And this is my motion.
I'll second.
Motion and second. Any comments? All in favor?
Aye.
Aye.
Motion carries. Thank you.
Right. Let's open back up. Item 4K, this is complaint number 24-0359, Covertress North America LLC, I'm sorry. Wholesaler introduced misbranded drugs by shipping them directly into consumer end users without adequate label instructions. This one, I think that there are still some unanswered questions that we had from the wholesaler. So my thought was conference on this one, because I think there's still some things we need to learn.
Exactly, that's what I was thinking. And unless somebody has comment, I will make it my motion.
Second.
I have a motion and a second. All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Tariq, you do 4L?
All right, now for L, I'm not mistaken, okay. For L 25-0323, Registrant may have failed to report charge within 10 working days. And this is the typical like failed to report.
Mhm.
And our standards was $250 fine. And
I agree. I would make that my motion to a standard $250 fine for failure to disclose or report.
so we have a motion.
I have a question. Wait, I one moment. Let me look at this a second. Yeah, maybe I'm just missing it. How long was she in custody?
I'm sorry, how long should what?
Was she in custody? How long were they in custody?
I missed that part. I don't know if this stays in the report. I didn't read it.
I only asked that because if you were in longer than the 10 days, it would be difficult to report it.
Do you have information?
Don't remember.
If Ms. Mitchell has, do you have information?
No, I don't. I'm looking through it to see if there might be some indication, but I'm not sure that she's explicitly stated how long.
That's my only concern in all of this.
Yeah, we had those situations before, and I believe we kept our standard that when people, I remember we have cases people stayed like more than 2-3 weeks on custody, and we still, the law is still having the 10 working days to report.
Yeah, but they still can't.
Yeah,
They can't, but Jen, correct me if I'm wrong, we were notified by DPS, right? Not by her at all.
That's right. Yeah.
So regardless of, I think statutorily, our rules say 10 days she needs to, but I think this had gone beyond 10 days. And we had been notified by DPS and not her at all until we reached out.
Okay.
And that would have been well after 10 days, Mr. Thorwald.
Okay. Then I don't have a problem.
so we have a motion, and I will second the motion. Any opposed? All in favor? Aye.
Aye.
Motion carries.
All right, item 4M, complaint number 25-0250. A patient received the wrong prescription. Looks like this one, there was multiple prescriptions for the same drug on the profile, and they selected the wrong version, which was ultimately the incorrect amount of medication. Depending on what the conversation was with the patient, I can totally see how that could have happened in practice.
So my understanding, and Mr. Jacobson can correct me here, they received a prescription. It was filled and ready to dispense when they received the second one.
Yeah. Oh, okay. Mr. Tariq, this is Max Jacobson, compliance officer. In this case, the patient had the same medication stored on their profile from historic usage. And then when the doctor called in the same medication for the current therapy, the staff at the pharmacy told me that the computer prompts them and says, hey, this same exact medication is already stored on the profile. Do you want to fill the old prescription before the new prescription in order to, use the old prescription first? The problem is in this case, although it was the same antibiotic, there were different lengths of therapy. So one antibiotic was a longer course than the other, and they were from different prescribers as well. And so that's really the crux of what happened in this case.
Yeah, so the system doesn't force them to fill the old one, just give them a warning. That's how I see it. Like
Correct.
you
Yes,
pick
sir.
it-
That's right. It seems like the system prompts the pharmacist or technician, whoever's entering that prescription. The system will give them a prompt, let them know that there's a historic prescription stored, and ask if they would rather fill that one instead. And that appears to be what happened in this case.
And did so that it prompted, so the system did what it was supposed to do, was, so then that essentially was overridden, or they accepted that particular prescription instead of the new one that was submitted.
Mhm.
Correct. That's the way I understand it. Yes.
In other-
Without realizing it was a different quantity and a different prescriber, possibly.
In other words, assuming that they were the same.
Correct. Yes,
Mhm.
sir. I believe that was the thinking. Yes.
Not exactly the same, different day supply, like different quantity.
Yep,
I could see how that could happen if
I
it's,
can too.
yeah, I could see how that could happen. If, I mean, especially it's the same medication, same, not knowing how that prompt displays, I could see how that could happen.
But to me, the pharmacist should, right, look at it, see what is the difference. Did they supply 3 times a day versus twice a day, right? It happens with something exact the same. When we talk about maintenance medications, when it comes to antibiotic or acute care, we cannot assume they are the same, even they are the same dose and same meds. I see how that happened for sure. I agree with you. But that's when we rely on pharmacists
Mhm.
to look into those things.
So, Mr. Al-Nassif, there's one other thing about this case that I found interesting, was that it's unclear who received that message.
Okay.
That pop-up that says, there's an old prescription here. Do you want to fill the old prescription? It's unclear if a technician entering the new prescription got that pop-up message and approved it, or if a pharmacist got that message and approved it.
Okay.
Was there any
wasn't-
DUR that
Um,
was?
I don't believe there was a hard stop DUR in this case.
And honestly, I mean, looking at the prescription that was filled versus the prescription that wasn't filled, I mean, the one that was filled was for a 14-day supply, which is more typical than the other one that wasn't filled, which is for a 3-day supply.
Mhm.
I don't know. I'm struggling a little bit with this one. Because like I said, I can definitely see how this could happen in practice. And I don't think there was anything intentional on anybody's part for this.
Yeah, I
So,
agree.
so Mr. Jacobson, when they put something on hold at this pharmacy, does it require pharmacist DUR verification, or technicians can put prescription on hold?
I can't speak to that, Mr. Al-Nassif. I'm not sure. I think typically, if I remember from my personal practice, it was not DUR pharmacist reviewed before it went on hold. But I didn't work at this pharmacy chain.
Do we want to have a conference to find out more about their system? I don't know.
Honestly, I'd like to hear from them. As much as it looks simple, and we might not learn something from them, but as much as for me difficult to recommend or make decision here.
I mean, it might be helpful to hear a little bit more about the pharmacist practice, or when that alert does appear, for evaluating a prescription that was, I mean, you have the written date, and yeah, I would be in favor of conference.
Okay.
Me, I see it differently. It's like you have two addresses, one in Phoenix and one in another city. Exact same address, but a different city. If you don't take the time to look at it, you'll end up in the wrong city, or you have that And I know I'm comparing cities to drugs, but
Yeah,
it seems the same thing here. If you take the time to look, you'll notice the difference. To me, it's error prevention, not necessarily the procedure that's taken or what they're doing. They just need to take the time to look and not make the assumption. That's my perception of the whole thing.
So I'm hearing you would recommend error prevention CE.
Correct.
I can go either way.
I'll make a motion that 2 hours error prevention for the
and do you add dismiss the permit holder, right?
yes.
I have a second. No second.
I mean, I mean, the error is happening. I agree with the fact. Yeah, I second this one. You know what I mean? But I still like to hear from them. You know what I mean? Because I need to know their workflow. It doesn't mean that I don't agree with the CE at the same time. But I second with Frank at this time. Yeah.
All right, so I have a motion and a second for 3 hours in error prevention CE for the pharmacist and the technician and dismissing the permit holder. Is that correct?
Yes.
All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. If you can do 4N, please, Tariq.
Complainant received partially filled Adderall prescription despite her request for full amount when more supply became available. So in this case, they give a 13 tablets of Adderall, did not have enough in the stock. It's a C2 Schedule 2 medications. They're required to fill the balance within 72 hours. They did not fill them and passed 72 hours, so basically they discontinue the prescription or not valid anymore. Provider send a new prescription, and I believe that they failed to notify provider. Is that right, Nancy?
Yes, this is Nancy, compliance officer, that investigated this case. That's exactly correct. It's a float pharmacist who was working the night, when he, verified the prescription. He was told that the patient wanted what's in stock. So he filled the 13 in stock and noted that, we have 13 in stock, but it wasn't clear as to whether his notation wasn't clear to really state that the complainant understood that that's what she wanted. But his understanding was that was a request from the complainant, and they did order the drug, but and he thought that he instructed the store to make sure that the remaining will be filled when he leaves the store, because he's only float there for 1 day. However, he couldn't remember whether or not that instruction got passed on to the next pharmacist. And he stated that the provider somehow had another prescription a week later to send in to discontinue the original prescription and go with another prescription. So the question as to whether or not anyone notified the provider after the 72 hours fill prescription, that was the question.
So do you have evidence that they did not
Because it was
notify the providers? Because providers sent a new prescription in a week and the patient has 13 days supply, right? Or they have 13 tablets. So do you know who notified the provider?
Well, that was the concern was, there is no evidence as to, any notification of the partial fill to the provider after 72 hours. And there's no documentation.
And we only, pharmacists only required, or pharmacy required to notify providers if they cannot fill the balance, right? If they fill the balance, they don't need to notify provider.
Correct.
Okay, so this listed pharmacist only float 1 day, give a partial, and then he did not come back to pharmacy during those 3 days. So me personally, I don't see any fault on the pharmacist's part. Right? Because he did not like follow up one while he's floating different locations. It's really, I don't see that possible for pharmacists to do so.
Who is responsible for follow-up when you have a floating pharmacist in there?
You follow a pharmacist. Is that right, Mr. Chang?
I'm sorry, what was the question?
I mean, it's a pharmacist's responsibility, right, to notify?
Yes.
Yeah, but that pharmacist is not at that location. The pharmacist is floater, like just showed up there to help with staffing.
I think it's down to communication, just making sure that there's notes, references to if 3 days later that
Yeah, I see.
partial hold, yeah.
I see the doctor send the prescription for a patient and things I don't think how that can be avoided. It should be avoided, right? I mean, I'm in favor of dismiss the case.
That's where I am with that, as well as dismiss, so I would support that.
Yeah, and this is my motion.
I'll second.
Any opposed? Frank?
I just have one quick question again. How does it? I assume it's different from pharmacy to pharmacy, but when you have a floating pharmacist come in that handles something, something needs to be followed through by the normal pharmacist that's there, how is that communicated from one pharmacist to the other?
Usually, I don't know what's happened there exactly, even whatever it says in the document, but usually pharmacists will have a discussion with the patients or patients rep that we don't have enough and we only have 72 hours. If we don't receive it, we need a new prescription. And this is a typical discussion should take place, and all pharmacists do that.
What I meant was, and maybe I'm not asking it right.
Yeah.
You've had that discussion. Now you are leaving and you're not coming back to that pharmacy, and another pharmacist who's normally there is going to take over. The pharmacist that is leaving, that was there for the 1 day, how do they inform the regular pharmacist who's not there that they need to follow up on A, B, C, and D?
I think there's multiple ways they can do that. They could still contact that pharmacy, the next day or subsequent days. They could, depending on how the system captures information like that, if there's any sort of like, hey, we're ordering this queue, fill on arrival type of queue, and with the prescription note, things of that nature. I think every system can be different, but there's definitely ways to make sure that care of that patient is continued and there's follow-up.
And they have not done nothing wrong. The only thing that when past 72 hours that we don't have evidence, they might or might not notify providers. And that whose responsibility? I agree with you, Frank, like who's gonna be responsible for this? Is it the pharmacist who's working in 72 hours? Or the pharmacist who worked 3 days ago, right? And I believe they share responsibility. It would be shared responsibility. But at this point, like the listed pharmacist, he's the only one pharmacist listed. who only worked 1 day. And I believe I can't, since we do not have evidence what's happened after fact, is the doctor notified? Like if they call a doctor over the phone and they didn't document it, it never happened, right? But they might did it. But there's doctors send a different medication, and just FYI, this medication has been on back order forever. Like a retail pharmacy struggling to get these medications.
I'm fine with the motion then.
Yeah. So, all right. So all in favor?
Aye.
Aye.
Motion carries. Thank you.
Okay, item 4O, complaint number 25-0263. To dispense the incorrect strength of medication to a patient.
My noise to see to hear back from you guys. I wait for your thoughts.
Well, this one, I mean, if I'm not mistaken, there was a prescription that was a starter dose, but it had a refill.
Yeah,
And
and it was really ultimately all due to a third party issue.
yes,
It
yeah, I
is what it looks like to me. And I feel
Yeah.
bad because the patient had a poor experience, but I don't know that the pharmacy really could have done anything differently if it wasn't covered by our plan.
agreed. I was having trouble seeing what I could see this happening.
Absolutely.
But yeah, not seeing where, yeah, it's unfortunate, like you said.
I don't know. I'm kind of the opinion that this one should be a dismiss. I mean, the patient definitely had a delay in therapy and definitely had poor outcomes, but it seems to me like the root cause is the insurance issue.
Insurance issue.
Board members,
Which is
can you hear
out
me
of-
now?
What's that?
Could you hear me now? Okay.
Yeah.
This is Ben Castellano, the compliance officer.
Yeah.
I just provide a little clarity here about the
Please.
timeline of things. So this prescription, 2 separate prescriptions were called in. Each
Each one.
one was a titration packet. The lowest strength was initially filled and it had a refill on it. And the refill appears to, according to the pharmacist in charge, was requested not by an automatic refill. I'm lacking the word here. Not by autofill, but it seemed to have been requested by the patient. So the
Okay.
refill of the lowest dose got refilled a second time prior to her moving on to the second start titration packet. That was where the insurance plan came into effect again with adjudication requiring prior authorization. So she received the starter pack at the lowest dose and then a refill prior to getting the next titration pack in line.
Yeah.
Yeah,
I think dismiss on this one.
I agree. I'll make a motion to dismiss.
Second.
Motion and a second. All those in favor?
Aye.
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 Any opposed? Hearing none, motion carries. Item 4P, complaint number 25-0322. The complainant, the patient stated that the pharmacist failed to address a drug-drug interaction, I'm sorry.
So there is like contraindication between those two meds. It is very like patients cannot take, and there is what pharmacists told the patient to do. There is no clinical evidence that the right thing for patients to do. The pharmacist said the patient had it before with no events or side effects, but side effects not always happened immediately or on the same time. We all know that side effects can happen later or with. So for me, I believe this is a concern. So I'm okay with 3 hours of CE.
I agree with 3 hours of CE. This one, what I think is interesting is it's kind of a he said, she said counseling type piece again, but what the pharmacist said they counseled the patient wasn't accurate anyways, even what the pharmacist admitted that they counseled. So it seems a little bit like a knowledge gap. So to me, patient safety CE seems to make sense.
Yeah, and dismiss the permit order.
I agree.
So this is my motion.
Have a second?
Second,
All those in favor?
Aye.
aye.
Any opposed? Hearing none, motion carries. Tariq, if you can take 4Q, and then I'm done with my recusal.
You got it. 4Q, case number 25-0302, pharmacy operated without designated pharmacist in charge. To me, like, is the district manager who should be in charge based on the documentation, but they forgot to notify the State Board of Pharmacy, which is, we have a rules here, and our standard is $100 fine goes for a permit order. It's non-disciplinary.
And then the other thing is there an issue with the controlled substance inventory not being completed?
So they completed it, but
Within 10 days.
I don't think they did. That's a good point. Mr. Castaneda, they did not do it within 10 days, right, of changing pick? I know they did not notify the board, but did they do the control?
So once the new PIC was assigned, they did complete it.
Okay,
But there was a gap between the outgoing PIC and the new PIC that took over, which was found
Okay.
during a routine inspection.
so that's really what we're dealing with is no PIC.
Yes.
I believe there is a PIC, right? But they claim they did not notify, like supposed to be the DM or the district manager. Am I wrong, Mr. Castaneda?
So, board members, the initial notification to the board after I did my routine inspection had a date prior to me going in there, and it appeared to have been backdated. However, in the response to the violation for failing to perform the controlled substance inventory, the new PIC stated that he did not take over until after my inspection was done in May.
And where is the previous PIC?
He left the company.
Is he still practicing in this state?
Yes. However, the PIC that was outgoing updated his board profile accordingly.
Yeah, it's a permit holder
So,
responsibility.
yeah, I was just gonna
Yeah,
say
it's
that.
not the previous PIC. Does our grid, I know there is $100 fine for not reporting, right? But there is anything, Dr. Gandhi, have you had these cases before? What's not having pharmacists in charge? Or not?
We have, and that's why it's on the recommendation, the non-disciplinary
Okay,
for 14 days. So
so I keep my motion, $100 non-disciplinary for a permit holder.
Second,
Second.
Right, we have motion and second. All in favor? Say
Aye.
aye.
Motion carries. Thank you.
By the way, can you hear me better now?
Yes. Thanks, Frank. Item 4R, complaint number 25-0319. The pharmacy dispensed a prescription with the incorrect directions. It looks like this one was typed and verified with the incorrect instructions. So a data entry error.
I'm so glad this like patient's wife really aware of this medications. Otherwise, that'd be different outcome. So I really appreciate the wife. Now it is error. It's a standard error that what we face, right? And our standard is like 3 hours. I'm in favor of 3 hours non-disciplinary CE for listed responded, and of course dismiss the permit holder.
Second.
Which one of the pharmacists? There was only one of the pharmacists that was involved in the dispensing, correct?
I don't think the PIC was. I think it was the staff
I-
pharmacist.
I believe the PIC,
The PIC corrected it, which it looks like they deleted it and then refilled it with the correct directions, which is why it was gone. So to me, that person has created somewhat of a record keeping issue.
Very true.
Ben, can you
Yeah,
comment on that?
if we look at, I think it's page 820. Unless it. Oh, and the page has changed since I was previously looking at this. Give me a second to find the credentialing. All right, so if we go to page 831, the initial data entry was done by Martha Apco, who was the PIC, and then when Kate Van Hassel went back and did data entry again, it's unclear to me who performed the initial one.
Who was
But-
the pharmacist on the actual dispensing of record?
I believe that was Kate Van Hassel that did the verification.
And ACPO was involved,
The initial data entry, it looks like. The very
so
top of the
she did the
page.
data entry and
Mhm.
the other pharmacist did the verification.
That's the way I
Okay,
understood it when I looked at the credentialing.
okay, thanks.
Mhm.
Okay, then I would be in favor of both of them getting the CE then.
Type of CE, please.
Error
3C
prevention,
and dismiss permit holder.
is that your motion?
Yeah, that's my motion.
Second, all
Second,
those in favor?
Aye.
aye.
Aye. Any opposed? Hearing none, motion carries. Item 4S 24-0630. The complainant provided a written request for the full board to review the executive director's decision to take no action on the complaint. The complainant alleged that the pharmacy is dispensing medications negligently and offering kickbacks to providers. Thoughts on this one?
I read it, really there's no evidence, like, many different agencies reply, they took time, and really I didn't see any evidence. I mean, I totally support the dismiss action for this, and that would be my motion unless somebody has the.
I'll
Uphold the-
second that.
So uphold the director's dismissal.
Yeah.
All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Item 4T, complaint number 25-0280. Pharmacy failed to comply with the reporting requirements outlined in ARS 362608 and failed to comply with a board issued subpoena. Looks like this has been an ongoing issue with this permit holder as well. Ms. Galvin, can we take this directly to hearing, or would we need to go to conference first and subpoena their appearance?
This is Jean. I apologize. The question was whether you can take it to hearing or you have to have a conference first.
Yes.
If you believe at this point there are grounds for suspension or revocation, you can move it directly to hearing.
But that would be the basis for a hearing, only those two actions?
If you're skipping the conference portion of it, yes.
Okay, that's helpful. Thoughts on this one, guys?
I support that.
Which?
Hearing, I mean, like, I don't know if the conference we can learn anything, unless they have any, if they fix the issue before the hearing. but it's been ongoing.
I would be for going on to hearing.
I mean, the ignoring of the subpoena is, to me, what perhaps is the rationale to move it up in the process to me. And the fact that this is an ongoing issue that goes back several years, it looks like.
Yeah.
2 years at least.
I'll make a motion that we move this to hearing.
And I second this.
Is there any benefit to giving them the opportunity to talk to us first?
I would not think so after this.
But on the hearing, we
period.
still have opportunity, right? During the hearing?
Mhm. Yes, they would have an opportunity to provide a defense.
Yeah.
I do believe there are, other cases where individuals have failed to comply with the subpoena, and the remedy there was a civil penalty. So if it is failure to comply with the subpoena and the additional grounds, just be sure to articulate that, please.
What have we done in similar cases? I know we've had issues where people haven't reported before. Have we just done a fine?
Majority, and I think, let me see if Doug is on. Majority of the time, we do work with them to, obviously, it might be a systems issue, might be a vendor issue. And we continue to work with them, but after, like in this one, it's kind of just ignoring the board's authority, which concerns me. But yeah, on a rare occasion, I believe we have issued a civil penalty.
And I mean, they've been delinquent 5 times for a number of days. We've made tons of effort to reach out to them, and then they just quit responding.
Yeah. Hey, John, did you want to chime in a little bit?
Yeah, if I could just add on to that, and they're still delinquent to this day. So they still haven't uploaded the missing days. I think we're going onward of 90 days upwards of not reporting to the PMP. But as Cam said, we usually will work with them. And in this case, they just are ignoring us.
And they're not responding to you at all, John?
Yeah, they're not responding to us at all.
I believe so the recommendation to add a penalty for not responding to subpoena, is that right, Mrs. Garvin?
I think that not responding to a subpoena would be part of the grounds for moving it to formal hearing, in addition to the failure to report to the CSPMP for such a long period of time. Those grounds are sufficient for a referral to formal hearing.
I mean, you could also just issue a consent agreement for a penalty, like per number of days and the failure to respond to the subpoena. And then if they don't sign the consent agreement and pay the fine, then it's going to end up in a hearing anyway. Just another alternative. Cam, did you have another
Also,
thought there?
Can
Well,
I
it's just-
clarify
it's just,
one thing real quick?
Yeah.
We didn't have a subpoena because we weren't asking them to produce records. At this point, we were just asking them to respond to our notice of complaint and our attestation form. And we couldn't get a response to that.
So they're not responding to our request, we did not subpoena them.
Correct.
Yeah.
They're just not responding to us in general.
To me, it's
Is this the first complaint? This one?
Off the top of my head, yes. I would have to do a double check.
I believe
We've worked with them on other occasions. So this has happened a total of 5 times?
There's been like
They've been
multiple
delinquent
violations.
a total of 5 times.
Delinquent.
Yeah.
So if there is no failure to respond to a subpoena, does that change things?
That would be 2 different motions, or maybe you have to
I
add.
think we should do a consent agreement for a fine, as my thought. I would think that
What
would
would
get
the
their attention.
fine, what's the standard for that, for the fine?
I
Per,
don't know that we have one. Do we, Cam?
Not for this situation, not yet. Anyways, we don't have
subpoena them.
a lot of data points on this situation.
I believe that my concern, they're not responding to our staff, they're not reporting. It's been a long time, ongoing issues, and they totally ignored our request. To me, it's significant enough to move for hearing. And we go from there.
I
And I-
still have, I haven't changed my thoughts either. I still think it should go to hearing.
Board members, if I can, this is Jennifer.
Yeah.
There was a question about whether there were other complaints. I'll let John speak to this, but there were 2 other investigations. So I'll leave it there.
Correct. They were investigations, but they weren't complaints, so they wouldn't have gone in front of the board.
So Tariq, Frank, is that your motion, is to move to hearing?
It is, yes. I haven't changed. I have a motion in a second.
Okay.
I maintain my second.
I don't agree with it. But we can see where it goes. All
Then
those
I-
in favor?
to full
I can-
board review next. You want to take it to full board review next week to see?
I mean, that's an option too. I mean, I guess let's see what happens here.
Madam Chair, if I may just throw in
Yeah.
a little, so I get we want to move to hearing, at least 2 of you guys want to. But if me behind the scenes can work out a civil penalty, maybe probation or something like that, would you then vacate the hearing?
I think that would be appropriate.
And get the reporting updated.
Yeah, absolutely. That would be one of the requirements. Yes.
I would modify my motion to say if that can happen, then I would want
Yeah,
to vacate the
and-
hearing.
Yep, and obviously if it doesn't please me and my staff, then we still have that hearing option to move forward with.
Okay, that's a good approach.
Do you also modify your motion, Tariq?
I modify my second, yes.
Okay. I have a motion and a second. All those in favor?
Aye.
Nay. Motion carries. Item 4U, complaint number 25-0202. The complainant stated that the pharmacist didn't follow the provider's heparin order and the heparin was dosed incorrectly and that they are responsible for the death of a patient.
I would like to take it to next week for review, just to like to hear from everyone instead of like give any recommendation. That's me. I mean, this is a mistake took place.
I mean, it looks like the root cause, it wasn't necessarily, they didn't follow their provider's order. They didn't follow the heparin protocol that the hospital had based on the patient's health condition is the way that I understand it. Although it looks like the hospital and individual have taken pretty significant corrective action steps. But I'm okay with if we want to talk about it as a full board next week. Other thoughts?
yeah, I'm okay either way with that. Similar notes that I made, it's selecting of the wrong protocol, and there was the pharmacist and the hospital review and corrective action was taken.
They added
but
system blocks, like a bunch of
Exactly,
different
yeah.
things.
added system blocks. So I'm good either way of having it heard for the full board. I'm fine
Frank,
with that.
thoughts?
Full board.
Okay, do we need a motion for that? We don't need a motion to send it for full board review, I don't think. Item 4B, complaint number 25-0290. I think you're recused on this one, Stephanie.
I am.
The complainant stated that the pharmacy dispensed the the incorrect administration directions. Looks like it was a typing error, and ultimately it was dispensed.
I recommend our standard 3 hours of continuing education, non-disciplinary, for the pharmacist and dismissed permit holder.
The only thing with this one is I feel like there was a lot of things that should have caused the pharmacist to catch this one. Like the dose of 1 ml would have been really, really low for this medication. I would have thought a DUR would have flagged because of it being so low, all of that. But I'm not fundamentally against the 3 hours of CE, but I think this one was a pretty easy one to catch.
Yeah, it is easy. I agree with you, you know what I mean? And mistakes happen, but I believe this is the standard. It's not malicious, not malicious. So this is my motion. This is my
3
motion.
hours patient safety CE for the pharmacist, and what for the pharmacy?
Dismiss permit holder.
Frank, thoughts?
I'm fine with that.
Do you want a second?
Second.
A motion, a second, all those in favor?
Aye.
Any opposed? Hearing none, motion carries. Item 4W, complaint number 25-0208. The pharmacy technician was working without a current license.
And Mr. Patel can correct me here. So my understanding, the technician was a floral technician, helped different location. The PIC or the PIC is only managing the HR partial of the employment.
Hi, this is Chirag Patel, Compliance Officer. Yes, you are correct. The technician does not work at the home store where the PIC is a respondent.
Thank you.
Why is the technician named on this complaint, Chirag?
Technician does not have a license.
They still don't
a
have
current license. So license expired October 31st and has not been renewed.
Okay, and they've worked 36 shifts at a number of locations.
After the expired license.
So what I was thinking, dismiss the pharmacist in charge because I don't think he had access to any of this information. And apply $50 per day, which is the maximum $1,500, will go toward the permit holder for that.
I could support that.
Yep.
So this is my
I
motion.
agree.
Second.
A second.
I have a motion and a second. All those in favor?
Aye.
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 Any opposed? Motion carries. Item 4X, complaint number 25-0304. Prescription was entered and dispensed for an incorrect drug. It looks like this was a data entry error.
I believe those two items, 4X and 4Y.
Yeah, are similar. However, it was interesting to me. I don't think that there's any proof necessarily that the pharmacist was saying that this was what they told the patient in this particular case, that like they could do this different substitution because of the shortage. But I think it's really interesting to me that it was the same kind of discussion that they had with the provider in the second one. So it makes me,
yeah, believe it.
yeah, I don't know.
Again, this is Chirag Patel, the compliance officer. I believe the prescriber got that information from the patient or complainant.
Is it the same patient?
Yes.
No, the same.
Okay.
Everything's the same. One complaint is from the complainant, the
And one is
patient,
from the
and one's
provider.
from the provider. The provider got the information from the complainant.
That makes me feel a little better. I don't know if that's,
There's still an error.
Yep.
It's an error. It's a typing error, and it's involved pharmacy staff there. Can we take both cases in one motion? Because they're the same individuals, same incidents, basically.
Ms. Galvin. I think we have to address them separately.
Because we're gonna apply two separate, you know what I mean? Like,
Yeah.
discipline.
I mean, my
This is-
only thought.
I'm
Go
sorry.
ahead, Jane.
This is Jean. I'm just going to be honest. I am with my daughter right now who just had a baby. So could you repeat
Aw.
the question?
Can we?
And I apologize.
Congratulations.
Thank you. I apologize.
Sorry, can we take two? I mean, we have two items or two complaints, but same incident.
But it was two separate complaints filed on the same incident.
Okay. And the question is, can you take them together? Can you consolidate them?
Correct.
Yes.
Yes, you may.
Okay.
I apologize.
Before you make a motion, Tariq, just one thought here. So I'm kind of like thinking about the whole just culture framework and the decision tree for it. Was this a intentional decision that the pharmacist made to substitute something because they didn't have something in stock, or was this really a medication error? The patient seems to think that the pharmacist did it intentionally because the other product wasn't available. However, the pharmacist is saying something different. So it's a little bit of a he said, she said. To me, if the pharmacist intentionally did it because they were just trying to dispense something to a patient, to me that's maybe rises to a little bit different level of action than if it was just an honest mistake.
It's hard to tell.
Yeah.
Hard to tell, and based on what the pharmacist said, it's a mistake. They never said that to patient or to provider.
Can I add something? This
Yeah.
is Chirag Patel. The pharmacy technician trainee stated that a data entry error was made because she was unaware of the differences between dextroamphetamine and generic Adderall.
So that
I mean,
made the error. And
According to the pharmacy technician trainee. The pharmacist stated that this was a dispensing error, not a deliberate therapeutic substitution on his part.
yeah. I just don't know where the patient would have got all that subtext. Like, it's pretty specific. Like, you need to write DAW1 on the prescription. I don't know how a patient would know that unless the patient is a medical provider.
Yeah, now I can see happen during heated discussion over the phone or whatever took place. My pharmacist said, okay, they are the same. Just kind of to easy it or to make it feel better.
You can
Which
go
is
to
a false information. It's a false information, should not come from pharmacists, right? But I really cannot see it. I don't see there's enough evidence that make me treat it beyond an error.
Okay.
Because technicians basically can protect herself or himself, says, you know what I mean? It wasn't my fault. The pharmacist told me to do, and I said I did what the pharmacist told me. And that will take her out of this and leave it only for pharmacists. But the pharmacy tech said she didn't know the difference.
Which I could see, especially for a new tech.
Yeah,
sure.
You could go to AI and ask that question online and get all the answers you want that you wouldn't know otherwise.
Yep.
So
that's what I see.
thoughts on emotion then, and we'll take 4X and 4Y together then, since we can.
Oh yeah, so go ahead.
I was leaning towards non-disciplinary CE for error prevention for the technician and the pharmacist.
Okay, thank you for your motion. I second that.
Okay, in the permit holder.
Dismiss.
Dismiss. I second.
All those in favor?
Aye.
Aye. Any
Aye.
opposed? Hearing none, motion carries. Item 4Z 25-0293. An expired prescription was dispensed.
I wonder why.
I mean, there's the system, there is a procedure to follow that wasn't, that would have flagged this if they would have scanned both of the bottles.
What I wasn't sure is if the system would have blocked them from dispensing it since it was expired. Like if they did 2 individual barcode scans, because the policy isn't in here, like,
It's, if it's just a barcode, it's probably not capturing the, I'm
But-
guessing it's not capturing
but
that
if it's the,
expiration date.
if it's the DSCSA one, it would.
So yeah,
I
don't
can
know.
give you some clarity on that. This is
Yeah, thank
Chirag
you.
Patel again.
Yeah, sure. If you can.
They are scanning the 2D barcode, which does block this the technician from filling something that is expired.
Hmm.
So if the technician had scanned each bottle, it would have blocked it.
correct. And the pharmacist did not have, they couldn't tell from the image, right?
No, I couldn't see it in there. It doesn't look like they took a picture of the barcode. But Chirag, do you know if their system tells you if it wasn't scanned? And if it blocks you from scanning the same thing twice?
Their system does tell them, or does tell the pharmacist whether something was scanned or not scanned. But since this one bottle was scanned twice, it does show up as scanning was completed.
Yeah.
And I think the pharmacist was going based off of not the manufacturer expiration date, but a date that was written on the bottle.
In the bottle the only bottle was scanned. So
The good bottle, the in-date
bottle.
one. Yeah.
Yes.
The date was incorrectly written on the bottle, and that's what the pharmacist used to verify that it was a product in date.
Gotcha.
Yeah.
And also this is another barrier here. Whatever they wrote on the bottle, is that right? Like expiration date, they put the wrong date there. Of course, not done by pharmacist, by whoever technician did that.
That is correct.
Yeah. So I would say this error happened because of the technician. It was the technician error. And this error, like technician misled the pharmacist, so my pharmacist wasn't able to catch this error. So unless somebody have any comments, I can make a motion.
Go ahead.
So my motion to dismiss the permit holder and the pharmacist and apply 3 hours continuous of education for pharmacy technician, non-disciplinary, on error prevention and patient safety.
I kind of think it needs to be disciplinary since they didn't follow the safeguards, right? If they would have used the system tools that they had in place, I don't know. But you're saying non-disciplinary?
That was my motion, but I'm willing to modify it. So what
I
you
mean,
said,
how does anybody else feel about it? I mean, I feel like, again,
so it's
like,
not typo error, it's not typo error, it's not overlooked something
this
intentional.
was somebody that just blatantly did not follow the policy.
I agree with you.
Or they scanned twice, but they
But we
scanned
don't
the
believe
same
that
bottle twice, right?
But we don't believe that their system would allow them to do that, Chirag?
Sorry, what was the question again?
Do you believe that CVS's system would allow the technician to scan the same bottle twice in the filling process?
Well, technician may do that, but there's no way for CVS to know whether technicians scan the same bottle twice or not.
The system doesn't block it.
The system only flags whether it was scanned or not scanned. But the SOP requires that they scan each bottle used.
Yeah,
You bring up a good point. Like, was it an unintentional error that she scanned it twice, or was it? I don't know.
She's so is the way I read it is that she indicated that she scanned the same bottle twice. I don't know if she did that, intentionally or not. Basically, I didn't draw that out of that she did that intentionally. So, I would be in favor of non-disciplinary, but still CE.
Yeah. So I maintain my.
The other thing, just the with the pharmacist, if I'm not mistaken, this is the verification happened through a video or like a picture of
image.
An image. And so I see where they would see that date on there, but my concern is that you should always be looking for the manufacturer date for something like that, instead of just assuming we're documenting the date appropriately on the bottle. So I don't know if a letter of concern to the pharmacist would be
based on the scanning, right?
They see. Oh, because they saw that, yeah, because they scanned the right bottle twice, basically. Yeah. Okay.
Otherwise, the system will reject it. So they sure if the technician did the right thing, so that for sure those not expired, both of them, right?
Yeah.
And that's why really the image only shows the label and the barcode. It doesn't show the expiration date. And that's why I believe pharmacists, I don't see pharmacists can be held accountable in this case.
Yeah, I see that.
Now if the verification like manually, then it's going to be a different story, right?
Mm-hmm.
So I maintain my motion to dismiss both perimeter horror pharmacist and 3 hours of continuous education, error prevention, non-disciplinary for technician.
I'll second.
A motion and a second. Any discussion? All those in favor? Aye.
Aye.
Any opposed? Hearing none, motion carries.
And I'm recused from this one.
Item 4AA, complaint number 25-0325. The complainant patient stated that the pharmacy did not refill her medication when requested.
Sorry, I'm just reading my notes here. So I believe this is, so what's happened, they use the refills to give 90 days supply. They have remaining less than 90 days supply. Technician sent a request and discontinue the prescription. And just the question is it normal for technician to discontinue or the system allow them without pharmacist approval?
Mr. Al-Nasib, this is Ram Kalapudi, compliance officer with the investigation.
Yeah, go ahead.
So the technician inadvertently discontinued the remaining balance on that prescription. The computer tried to autofill 90-day supply, but there was only 60 remaining, so the computer could not proceed with the refill. It put that in the fax queue. So the technician sent the fax, but inadvertently discontinued that 60. So the pharmacist did not research enough. They thought that the doctor discontinued it, and they called the doctor's office, they called the insurance company, they tried different ways of getting hold of the doctor to dispense, but the doctor was not reachable. But here, essentially, the pharmacists, even though they are with the system for some time, they know the system, they did not do enough research to find out what sequence of events happened. So the patient did not get the medication when she needed. And subsequently, the patient got the prescription sent to another pharmacy and got it refilled. But these two pharmacists involved, did not do enough research to find out what happened.
Thank you. Thank you.
Yeah, no problem.
I have
So,
a question. Go
yeah.
ahead, sorry.
I just like the pharmacist could have just reassigned to a new prescription number. Like pharmacist knew that there's 60 tablets remaining and there's a glitch in the system.
Yeah, they did not do enough research. They assumed that the doctor discontinued the medication.
Yeah, I mean, they can reassign it as a new one and give them the 60, the remaining.
Yeah, they could have reactivated the prescription.
Yeah. Sorry, Frank, I interrupted you.
No, I'm sorry. I was the interrupter there. How does, for layman here, how does it work to track when a pharmacist reaches out to the doctor? They keep a log of the phone calls. Obviously, emails are easy to track. How about faxes? How is that recorded when those contacts you make those contacts?
This is Ram again, CO, Mr. Frank. This is in their response. They made those calls, but I did not request for a telephone log or anything for the investigation. But in their responses, they did say that they reached out to the doctor multiple times.
I asked that because the question in my mind is, and this is just a generic question in that and concern is, just because you say you reach out, did you leave a message at the doctor's phone, or did you leave a message at their office? If you sometimes messages don't get recorded properly, is a message, a phone call the best way, an email a better way? Is there a way to ensure that it gets into the doctor's system?
Unfortunately, there's not usually an easy way to email doctors or any of those types of things. It's typically going to be phone calls or faxes or an electronic message, but typically phone call would be the way that this would be handled. I feel like the pharmacist was also kind of in a tough situation too, because when they reached out to the prescriber's office and the prescriber's office called it back, the prescriber's office said, don't refill it. So they didn't even feel like they were compelled to provide an emergency supply to the patient, which would have been the other good thing from a standard of care standpoint. But when the provider's office called them back and they said, don't fill it, don't refill it, tell them to go to the urgent care, I don't.
But Lori,
the pharmacist is kind of in a bad place at that point too, because if they gave the medication to the patient and they didn't believe that the doctor wanted them to have it anymore.
After fact, yes, but this could be avoided by
with a little more research.
Yeah, I know it's 60 remaining, and it just write a prescription or notes or something, until I will investigate with IT, not holding patients away from their medications. And I know there is 60 tablets. And now they call a doctor, and who knows who answered? Is like an NA or not aware of. Somebody on call, said, nope, don't give it to him or her. But I see that both ways, right? But they should have done more research on this to help the patients. But I don't see at the same time there is any intentionally or malicious act to hurt the patients, right? They should have done better. So, I believe a type of advisory letter to pharmacists and pharmacy technicians and dismiss the permit holder. That's how
letter of concern.
Yeah.
I second that.
I can support that. All those in favor?
Aye.
Aye. Any opposed? Hearing none, motion carries. Item 4AB, complaint number 25-0312. A pharmacy employee performed technician activities without a current license. Looks like they worked a total of 4 shifts with an expired license. I think this one is kind of our normal standard, so a fine per day to the technician and to the permit holder. I think the normal is what it is.
For the manager, it will be 3 hours CE in law, right?
Yeah, 3 hours CE in law for the technician, $30 per day for 4 days, so $120, and the permit holder $50 per day.
Yeah.
So $200.
Yes, that's what I have it here. So technician, it's $30 per day, right?
And permit holder is $50.
$50 per day. And 3 hours non-disciplinary in law for the pick.
Yes.
Who was the pick there? There's no.
Yes.
There's, oh wait, never mind. Okay. Yep.
I support that.
Is that your motion?
Yeah, I make my motion. This is my motion.
Second.
A motion, a second. All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Item 4AC, complaint number 25-0178. A technician alleged that she was assigned to perform work prior to receiving training on the assigned task. Looking at this one, it seems like a he said, she said, but Walmart or Amazon has the records to prove that she did do the training.
Not for this specific area, but I don't know if they're required for every single area to have a record of training. Steve is still there?
Do you have anything to add on that one?
Yeah, I can provide with some additional insight or information. This is Steve Hyber, compliance officer again. Many companies will have very, very high level training where, yeah, we train them on the company policies and procedures. In this particular company, the processes that they assign employees are broken up, and those processes are the employees are individually trained to those processes and individually documented. In this particular situation, the complainant stated she was not trained on that particular process, and the company does document each individual process. Therefore, we requested the records of training, and that training was not documented. So in essence, they didn't follow through on their own policies for documenting training. And they did state in their response that the employee was subsequently trained. So
Mr. Omsi, they have the training documented in general, but for this particular, they don't have it. Even they said yes, but this is their own internal policy to have documentations.
they maintain that documentation, yes, for each individual process, because as you know, it's a large operation. Employees can be doing various tasks, and they don't train every employee in every task. So they need to know the who, what, and when, and when they were trained. And so they break it up that way in order to ensure that the employee is trained.
But away from this report or complaint, if we audit them for their training logs, it's satisfied, like it's okay.
Overall, they do document training. It's just that in this particular case, the employee alleged they were not trained, and the permit holder didn't provide us with that documentation.
Thank you very much, Divya. That's very helpful.
All right, let me just restate. They eventually provided it, but at the initial time when we asked for it, it wasn't documented. So just to be clear.
It wasn't
So
documented.
they do have the documented training.
They do now, yes.
Okay.
So, but in other words, It's a gap. We pointed it out and they closed it.
Okay.
So, and the rest of the complainants, I believe this is internal policy, is not board related. I believe they are aware of the issue, but I would like to document it as advisory letter for the permit holder and to the PIC, to the pharmacy manager as well.
I
And this,
second.
Is that your motion, Tariq?
yeah, this is my motion.
Oh, I
and-
thought that was a motion. I
Do you have a
second.
second? Okay. I have a motion and a second.
So we
All
second
those-
each other without motions. Just-
Okay. All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Item 4AD, complaint number 25-0359. Prescription medications were dispensed without a valid prescription order.
That's interesting case.
Mhm.
It's not once, right? My understanding to multiple people. I believe this will violate basic law with our board, and I believe we have taken like we put people on probation for those kind of actions.
I agree, and usually have done a fine as well.
Yeah, then we're fine. So I believe we need to. Do we need to go to conference for this, Mrs. Wormsley?
We could offer a consent agreement if we can decide what we want to do with it.
Yeah, I moved to consent agreement for probation,
For what period of time?
1 year. And we have
We
this
don't
kind
know how many times this was done because they were just handing the medications to the patient, so there was no records.
there's no records for how many, yeah. I mean, this, and the pharmacist said like multiple managers,
Mm-hmm.
so with the S, so could be 2, could be more. I mean, and our standard is 1 year or 2 years, our standard, I forgot, 2 years, right, probation?
We could do whatever we want on this.
And we have standard verbiage, is only I do it for 1 year probation and cannot be, of course, like pharmacy manager or preceptor during this probation time.
What's a
agree with-
typical fine that's been
We add
put for
the,
something like this?
I mean, I think we've done like per occurrence before, but we don't know, Cam, what they've done, right?
That's correct.
So I don't know. I'm thinking maybe $1,500. That's the max we can do.
I will go with max, whatever max we can do, like if it was $1,500, I go with the max, $1,500.
Do we want to consider CE in there too?
I believe,
For law or ethics or something like that? I mean,
it's not, I mean, will the CE help him? I mean, like, he knows the law and he admitted it. It's just sometimes the ego, sorry to say that, or like people think they can do whatever they want. I don't see the CE, but I mean, whatever it takes to just send a strong message to
I
everyone.
mean, I would think a year probation would clearly send that.
Okay. So I don't see, I mean, me personally, I don't see the CE will do anything. So I'm fine with the consent agenda for a consent agreement for 1 year probation and $1,500 fine.
There's Madam Chair, there's 2 violations and our authority is $1,000 maximum per violation that you could
It's
issue.
1,000, not 1,500, I'm sorry.
Okay.
There's
So-
2 violations, so 1,000 each. Is that what you're suggesting perhaps?
Yes.
Okay.
Tariq, are you good with that for
I'll
both
modify-
causes?
I'll modify to 1,000 each, 2,000 total.
And that's only because we don't know the volume. Of
Right.
this. Otherwise, we would have calculated based on prescriptions.
Mhm. Okay, do I have a second?
I have a quick question before the second.
Please.
In his response, he said he was giving this to it appeared like he was giving it to other coworkers. Do we have any indication from any of the other coworkers, or any comments from them?
He admitted it. I mean, I don't think they reviewed any of them.
I know what I was trying to really getting at was how often, or if this was a common thing, or I'm just wondering if there was any other feedback from the team that worked there, and the simple fact that they're asking him to do something illegal anyway.
I don't know that they were asking him. I think he was just doing it.
That's kind of how I took it, is that they would approach him of like, what can I do? What can I take? I
And
feel
he
like
was, and he
Yeah.
just handed him a Z-Pack and a
Right.
methyl dose pack.
Yeah.
that's, yeah.
You're feeling bad, here you go.
Yeah,
Mhm.
really good. I second the motion.
I have a motion and a second. Any discussion? All those in favor?
Aye.
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 Any opposed? Hearing none, motion carries. Takes us to our final item 4AE, complaint number 25-0217. A licensee failed to disclose criminal charges on his application for licensure. The licensee also failed to report charges within 10 working days.
Mrs. Walmsley, like based on what I read, there is more than one charges or arrest. I believe 3 of them, right? And one took place in 2017 and one in 2024 and 2021, right? 3 of them.
Is it 3 or is it 4? There was a criminal damage in March 2017, a DUI in 2021, driving unsuspended license 2021 and 2024.
He had a total of 4 charges. He reported the DUI after the fact, but he did not report it on his application.
But how many DUI? There's 2 DUIs, right? One of
Just one DUI.
Just one
He
DUI.
was driving on a suspended license twice.
Okay.
And there's some question about the 2017 that he wasn't unaware of the criminal damage.
What was it? Did it? I don't know if I noticed it, but did he to say what he was under the influence of?
For the recent DUI,
Yes.
alcohol.
Alcohol, yeah.
So Jennifer, it's for failure to disclose.
He failed to disclose 3 of the charges on his initial application, and then 1 after the fact.
So really,
report.
basically twice. He's
Yeah.
not disclosed.
Yeah. Yeah.
Okay, but multiple charges, but 2 failure to disclose
Yes, that's correct.
occurrences. Okay. So I would be in favor of a $500 civil penalty, non-disciplinary, for failure to disclose, $250 per occurrence.
And this is my motion.
Second.
I have a motion and a second. All those in favor?
Aye.
Aye.
Any opposed? Hearing none, motion carries. Did we hit everything, staff? I think we did.
I have a question before we quit today.
Yes.
When a pharmacy is providing a patient a particular prescription on a regular basis, and they end up using a different supplier, and the pills are different color or a different shape, is there any notification required to explain that to the patient, to the recipient of the drugs?
Kim, can we maybe look at adding that for a future agenda, since that's not on the agenda for today? Or take that
Yeah.
offline with Mr. Thorwald?
Okay. Thank you.
Kim, did we get everything else?
I believe so, yes.
All right, we will adjourn then for the day. Appreciate it, everybody. See you all next week. Congratulations again, Gene, on the new grandbaby.
Yes, congratulations.
All right, take care, everybody.